Okay, let's move on to the finances of locuming. To me, this is interesting. So, what's the basic model of compensation when you're on locums? Because, in the academic centers, at least, some of us are fee for service, some of us are salaried. How does it work when you're locuming?
So when you're locuming, there's different sort of buckets of money, I would say. So
Yeah.
let's say you go somewhere in Northern Ontario. The bulk of your earnings will be fee for service.
Hmm.
So in a very busy on call, in a very busy 48 hours, I would see up to like 40 new consults. So, like 40 new consults times, I don't know, like $300 on average. If my mental math is right, that's like 12,000 bucks.
Yeah. Yeah.
So that's, that's a lot of money. And then, if you're doing locuming where it's like not that busy, you can also just opt to get a per day amount. So for GIM, that per day amount would be like, maybe it's $1,500, $2,000, and you'll run a list of maybe 8 to 10 patients. So not all that busy. So that's one bucket of money. And then you get stipends when you're in the north. So that covers your sort of daily costs. It's about $300. You also get paid for your travel time. So that's another bucket of costs. And then there's on-call bonuses that you get. So back when I was a grad student and I was going up there in a very, very busy 2 days, you could make anywhere from $12,000 to $15,000. And before they had a cardiologist, I would also read the ECGs, and it's like, $5 a click, which may not sound like that much, but when you're like fresh out of residency, you're like, yeah, like this is fun.
Yeah.
Every click is $5. The times have changed a bit. But those are sort of the main ways that you get paid
Okay.
when it's in an underserviced area. The daily amount obviously varies depending on the specialty that you're in. But then when I locum at somewhere like Michael Garron or St. Joseph's Hospital, same thing, right? So your fee for service is the bulk of the money that you're receiving, but they also give on-call stipends anywhere from
Okay.
$500 to $1,500. So that's sort of the type of way that you get paid for your time up there as a locum physician.
So the on-call stipends, that's per call shift. That's what they will pay you kind of like, sorry, on top of what your billing fee for service or
Correct. Yeah.
wow,
Yeah.
wow,
Yeah.
okay.
So it's like a
Okay.
hospital on call. And then when I'm in the SU, I'm also the like stroke physician on call. So there's a stroke on call stipend as well. Yeah.
Okay. Now, in terms of billing, because for a lot of us, like for me, it's a bit different as a radiologist because our billing codes are essentially embedded into our PAC software. But for a lot of other physicians, they have to figure out how to bill efficiently. I'm just curious, Mike, in your experience, did locuming teach you those skills, like to bill efficiently to kind of optimize your day to day?
Yeah. And for us, it's not embedded within the EMR. It would be incredible if it was, because I don't enjoy the process of billing. I started out with Agent Plus, and their software is just not that great. And now I use MD Billing. I have no affiliation with either, I should mention.
Yeah,
But
yeah.
it is quite efficient, so that now, like, I'll see a batch of 5 consults and then I will just bill on the spot. It's pretty easy with, the app and the desktop version they have. Um, and then I think how people bill in the community is different than how people bill in a downtown setting, because in a downtown setting, a lot of physicians, the bulk of their earnings don't come from billing. So they're a little bit less savvy, and sometimes, a bit not the best people to learn from. So I think it was also just interesting to hear from the community physicians, oh, well, this is what I bill in this scenario. And, oh, there's a code for that. It's like, oh, like I had no clue. So yeah, that's kind of been my approach, and definitely it's helped me to be, more efficient with billing, and also get a sense of what other people are doing and how they're billing for their work.
Okay, so let's talk quickly about what expenses can you write off when you're locuming because you're going to have to travel up there, you're going to have to stay somewhere, so you have accommodation expenses. So can you give us a bit of a summary on what expenses are written off here?
Yeah, so they actually pay for all of those costs. So they pay for
They
your
do.
flight, they pay for the
Okay.
hotel, they pay for the rental
Okay.
car, and they book it all for you. So it isn't that like sort of frustration and friction of having to
Wow.
book those things yourself. They pay for the gas. You have a per diem for your food. So in the end, I don't write anything off because I'm not
Okay.
paying for it.
Okay. But being an academic physician, let's say you locum somewhere for a few weeks, you make X amount of dollars. What are the tax implications? Talk to us about that.
Yeah, so my colleagues in the SU are always amazed. That's a nice way of putting it when I tell them this. So all the money I make in the SU, it all flows through Mount Sinai. It flows through their practice plan. And that's because I get salary support as a clinician scientist. So I am billing, and then those billings go into the pool at Mount Sinai. I don't actually, it's not like I'm sort of receiving another check for my clinical duties in the SU, if that kind of makes sense.
Yeah.
So it all just flows through Mount Sinai, and most hospitals in Toronto work like that. I have no clue how hospitals work outside of Toronto, but I imagine they don't work like that.
Okay, so what you're saying is you earn X amount of, or you bill X amount of dollars, but that money is going to flow through uh, Mount Sinai and then kind of get distributed. Kind of the pie will
Precisely.
be split then, essentially. Okay, okay,
Yeah, yeah.
fair
So, and I
enough.
should say, Atin, like when I was a grad student,
Yeah,
it
yeah,
was different. As a grad student, I'm not part of a practice plan. That is when it
right,
was
right.
most sort of lucrative for me to do that work, because
Yeah,
all of those billings were coming to me and then the tax man, of course. But the actual financial gains of doing locuming right now, there aren't a ton at the stage that I am in my career. I still do it because I feel like it gives me my time back because I'm not doing as many weeks of service at Mount Sinai, and
yeah.
I love direct patient care, and I've created this sort of like it's a fun
Okay.
group of people to work with. Mm-hmm.